name is Elle Saine. I'm an infectious diseases fellow physician and epidemiologist. And this past year, I had the honor of being a Doctors for America Capello Health Advocacy Fellow working with the FDA Task Force. I also serve as the co-chair for the Public Health Task Force within Community Health and Prevention Impact Area with my friend, colleague, and co-fellow, Noah Erlitzky. I want to share some of the things we worked on this year. But first, a little about me. I grew up in rural PA. At the age of 7, after 2 of my friends were killed by a motorist, I begged my parents to let me speak at the town council meeting to advocate for speed bumps in my neighborhood. This early experience taught me the power of my voice to make the world safer. This past year taught me to use that voice to more effectively advocate for public health. One of the first initiatives that we worked on this year as a public health task force was a physician voter advocacy initiative. Historically, physicians have low voter turnout, and we know that voting impacts health and has been identified as a social determinant of health. I participated in several nonpartisan initiatives to increase voter registration and improve access to voting. As a public health task force, we developed a toolkit to help physicians develop plans to vote and participate in nonpartisan physician voter advocacy, including a physician-led video on why we vote and why voting is important to health. As a public health task force, we have been working hard to protect vaccine access, raise awareness, and combat misinformation. In October 2024, we hosted an advocacy grand rounds with 3 experts who taught us about combating misinformation and science communication strategies. In our grand rounds, we learned the importance of amplifying accurate information as a means to combat misinformation, and we've put this to action in a series of infographics on vaccination, including collaborating on measles infographics and a forthcoming Vaccine Awareness Month information campaign this August. We've been vocal advocates for health policies that improve access to public health and protect health infrastructure. In January, we held an advocacy grand rounds on the role of policy in public health. We have released several statements on the need for robust, independent, and science-based public health infrastructure and have been vocal advocates against changes that undermine public health. Following the HHS layoffs, I was honored to participate in an episode of the Care Talk podcast to talk about the impact of these layoffs on public health and the future of scientific innovation. When critical health guidelines and health data were removed from the CDC, FDA, and HHS websites on January 31st, we immediately got to work to develop an advocacy alert calling for the restoration of these critical guidelines. On February 4th, Doctors for America, represented by Public Citizen, sued for the restoration of these essential clinical guidelines and public health-related data. Following an early ruling for a temporary restraining order in July, a federal judge ruled in favor of DFA and the City and County of San Francisco, which was a win for all health professionals and their patients. As a member of the FDA Task Force, I have learned so much about health policy and advocacy this year during our monthly meetings, but the best experience was having the opportunity to participate in 2 fly-ins to meet with policymakers in D.C. These incredible opportunities not only gave me the opportunity to advocate, but helped me develop and hone my communication skills for sharing my expertise and learning from the incredible FDA Task Force leadership. I also got to meet and spend time with many of my co-fellows and DFA colleagues who are some of the most incredible people that I know. We've communicated with legislators through both national and local Docs on Call events. I co-hosted one of our first national Docs on Call events this spring to advocate for the restoration of the CDC guidelines. Within the DFA PA chapter, we have hosted weekly Thursday night Docs on Call events to call our state legislators to advocate for the passage of several healthcare protection bills. And these weekly calls have given us the opportunity to teach colleagues across the state about calling legislators and to create protected time to advocate for local and state changes that will protect the health of our patients. With all of this in mind, one of the most important lessons that I learned this year is the power of making advocacy accessible. Drawing on low-barrier models that we use in ID, we participated in several initiatives to make advocacy more accessible to health professionals, including the Advocacy and Action Initiative of 5 daily activities, which Noah led, as well as using social media to encourage people to advocate, and a low-barrier legislative call script initiative on ID-specific issues that 3 of my co-fellows and I started. Few things are more low barrier than peaceful marches and protests to raise awareness and advocate together. I have participated in several marches with friends and co-advocates, such as Marches for Science, to protect reproductive health care access on the anniversary of the Dobbs decision, and to advocate for vaccine access. Finally, my capstone project was the development of an advocacy curriculum to introduce ID fellows to health advocacy and develop skills that can be used in both advocacy and future careers. This 6-session curriculum included a combination of guest speakers and skill-building exercises. The curriculum is ongoing, and I've learned so much from my friends, colleagues, and mentors. It's been incredible to share some of the skills I have learned with others.